Hello, I'm Dr. Vimee Bindra, gynecologist and a laparoscopic surgeon at Apollo Hospitals, Hyderabad. So friends, today we will be discussing about pap smear. Pap smear is a simple screening test for the detection of cervical cancer. Women may have different type of cancers. They may have cervical cancer, uterine cancer, ovarian cancer, breast cancer, fallopian tube cancer. Out of all those cancers, cervical cancer is the one which can be prevented by a very simple test called as pap smear. This test is done in the outpatient when you go to visit your gynecologist. They will just see your cervix and take a sample from the cervix. It's not painful at all. It's a very simple test. Many women don't get it done because they think that it may be very painful or it is done under anesthesia. This is not done under anesthesia. When a doctor examines you in the patient's couch, that time only we can take the sample and send it for testing. It is a very sensitive test for the detection of cervical cell abnormalities. In case anybody's pap smear comes abnormal, we usually plan for colposcopy and biopsy from the abnormal areas. If colposcopy facilities are not available, we can do visual inspection with iodine or visual inspection with acetic acid. Cervical cancer also has pre-invasive stages which can be treated conservatively. There is no need of hysterectomy in the CIN1 and CIN2, that is cervical intraepithelial neoplasia 1 and 2. That is staging we do depending on the pathological findings as to how far the cervix and cervical cell abnormality has invaded the epithelium. So don't get scared by this test. You can protect yourself from cervical cancer. Another way of protecting yourself from cervical cancer nowadays is taking a vaccine against cervical cancer. Cervical cancer is caused by a virus called as human papillomavirus. So there are two types of vaccines. One is directed against high risk HPV only, that is 16 and 18. Another one is directed against low risk as well as high risk HPV 6, 11, 16 and 18. Depending on what your doctor advises you, do take the vaccine. You should take 3 doses of the vaccine at 0, 1 or 2 and 6 months. But let me tell you, dear friends, that taking the vaccine is not 100% protective because there are different kinds of HPV. So if you take the vaccine, even then you should go for your regular pap smears. You should do annual pap smears from 21 to 30 years of age if you are sexually active. And after 30 years of age, once in 2 or 3 years is enough. And if you have done 3 consecutive pap smear samples and they are negative, you can even stop screening. So don't hesitate, talk to your doctor. Even if you don't have any problems, please get your pap smear done. Thank you.